Hello and welcome. You're watching News Now. Let's start with the news that matters to you. Of course, most of us like jalebis and samosas, but beware before you bite into your samosas and piping hot jalebis. Recent reports suggest government has put them under scanner. However, officially there is no confirmation which has come in from government. In fact, government has denied the reports. My colleague Anjali is joining. What was the actual plan?
Well, this is a plate of piping hot samosas and some varas, a pretty standard Indian breakfast. However, the next time you may be served these snacks, they may be served with a side of a health warning. This is an initiative by the Union Health Ministry wherein they want to raise awareness about the oil content and the trans fat as well as sweet content in popular Indian snacks. Therefore, your snacks such as samosas, jalebis, varas, or even pakoras, these are going to come with a health warning. The pilot for this initiative has been started in the Institute of the All India Institute of Medical Sciences, AIMS, in Nagpur, wherein the canteen will display the oil content, the sugar content, as well as the trans fat content in popular Indian snacks. Now, this is obviously because India has a rising problem of obesity, and the Union Health Ministry wants to raise awareness about exercising caution while consuming these snacks and also having them in moderation. Therefore, now these snacks may come with a warning, a health warning, much like a pack of cigarettes does.
Thanks, Anjali, for those details. But the bigger question is, should there be a health warning which needs to be there on street foods? I am being joined by Haresh G. Mehta, Director Interventional Cardiology, SL Raheja Hospital. Thank you so much for joining us, Mr. Mehta. First, I want to understand from you that is samosa, as well as if you can consider jalebi, is as bad as smoking cigarette?
I think anything in excess can be bad. So samosa and jalebi consumed every day can be as bad as smoking cigarettes because there are more hidden problems than we know. Because cigarettes come with a warning, you know that tobacco kills, but nobody tells you that trans fats kill and the excess sugars that come with it or processed foods also can kill.
But the another question arises with the thought of having a warning on street foods. Of course, cigarette is a packaged item. Now, in terms of implementation, what is the expectation? Should there be a warning on the stall itself?
I don't think they should put a warning because that will create a fear, but I would say they should definitely write the contents that are there. So, the calorie content of the per samosa, how much is the saturated fat, how much is the protein in that, how much is the carbohydrate in that, and how much trans fats are in that. I think that all should be mentioned for public awareness. I would use it more as an awareness tool rather than a fear creating tool.
Of course, that needs to be clarified. It is more of an awareness campaign rather than warning.
Yes, I think they
Because
are trying to cover awareness. That's what I gather. They're trying to cover awareness so that people eat more responsibly.
yes, that should be there. So the expectation is that whomsoever is consuming the item, whether be there in canteens or any food stall or any public place, at
Right.
least the consumer should know what they are eating, what kind
Yes.
of health hazards are there, which can be there due to whatever it may be. It may be vada pav, it may be samosa, it may be
Oh.
jalebi. But in terms of health risk, doctor, I want to understand from you. Often these kind of food items are more consumed, and do you think it is more of a lack of awareness or it is more of a compulsion or taste buds?
So I think it's a combination of lack of awareness and a little bit of wanting to consume it irrespective. That also happens with smoking too. But I think people are not aware of what trans fats can do, what saturated fats can do, what excessive sugars can do. So I think they need to be more aware because most of these problems we face with heart diseases are lifestyle driven. And one of the major factors is nutrition and diet. So that can go a long way in preventing diabetes in our country, obesity in our country, and also reduce the burden of heart disease in our country.
Yes, sir. The larger question is India is a place which has high risk of many patients who are suffering diabetes, obesity, and that is something which we do not look from point of view of health hazard or the intervention which government, the attention which needs to be given, that is often overlooked. Do you believe that and more should be done?
I think so. I think that the government is actually going in the right direction now. All these years, I've realized that the public does not take interest in educating their population. But we need to educate our population on the pros and cons of whatever we do and encourage them to lead a healthy life with making healthy choices.
A counter question is there if I become a devil's advocate. As soon as this news broke out that government is planning these kind of warnings, if you look in terms of implementation, how that can be done, because most of these food items are sold in open. You have different kind of places where people go and enjoy this, but nobody is expecting any kind of warnings or risk there.
So I think that it should always start with packaged foods, which they've already started doing, which I see now that most packaged foods have the calorie content, have the oil that is used, how much is this. I know that it's going to be difficult to implement in every stall, every shop to know the exact calorie content. But I feel it's a step in the right direction. And it's not being anti food. It's not being anti people selling food on the street. I think it's just making them aware that it is your responsibility also to inform your consumer that this is what we are serving you and this is what we are putting in this food. Otherwise, we are always irresponsible and we can always say that we did not know that this was inside the food I ate or that was inside the food I ate. So I think it may be difficult to implement to get the exact calorie count or the exact fat in that street food, but I think it's a step in the right direction to encourage people to be informed of what choices they are making.
The news flashing on your screen as we speak, government has clarified its stance. It says that
Right.
separately issued an advisory which is an initiative towards
Right.
making healthier choices at workplaces. It advises about display of boards in various workplaces such as lobbies, canteens, cafeterias, meeting room, etc., as we were discussing, to raise awareness on harmful consumption of hidden fats and excess sugar in various food
Right.
items. These boards are meant to serve as daily reminders on fighting obesity, the burden of which is sharply rising in the country, the concern we raised in the show. And also, the Health Ministry advisory does not direct warning labels on food products sold by vendors and has not been selective towards Indian snacks. So that clarification coming in from government side, they have clarified it does not target India's rich street food culture. So that fear has been allayed. Doctor,
Right.
now that government has clarified the position, it is more of an advisory than a direction which has come in, and also it is not direction, it is not targeting the street food vendors. How much of this clarification helps?
No, I think clarification is important because most small businesses must have got worried that if I'm going to be forced to write what I'm putting and all, and it may lead to lack of business and all that. So I think it's a good move by the government to inform that they are going to have the same rules for packaged food versus street food. And it's an important thing that everybody should be able to convey what calories there, what content is there, because it's the right of the consumer to know what is he eating and what is being supplied to him. For example, in foreign countries like in California, if you know that it's a completely trans fat free state, so they give you incentives to have a state which is completely trans fat free. Trans fat is a bad fat. So I think the same thing should be done in our country.
All right. One last question before I let you go. What should one do to avoid these health risks? Now, government is taking their initiative. Anyone who's watching currently, what will doctor advise?
So the advice would be to live healthy. So eat well, eat right, avoid addictions, sleep well, and lead a stress-free life. Probably try some meditation, try some alternate therapies like yoga to calm yourself, and then I'm sure you'll be not having too many lifestyle diseases.
And not too much addiction to these kind of foods.
Yes, everything has to be in moderation.
Right. All right, Dr. Haresh Ji Mehta, thank you so much for
Thank
joining
you.
at this hour. And also, government giving clarification that it is not in direction. Nobody is directing street vendors. So, not to be feared by any kind of government direction. It is more of a directive. It is more of an advisory which has been given by the government. But